So, good afternoon. I'm Dave Booker, Dean of the College of Arts and Sciences, and I want to welcome you to the continuation of our year-long virtual seminar series. The goal of this series is to showcase the great work our college faculty, students, and staff do to address the critical challenges of our time. We initiated this series last fall semester, beginning in September, when we featured a discussion called Understanding the Pandemic. For the first seminar in spring 2021, we will have a much needed discussion on vaccines, with attention being focused on the vaccines developed to prevent the spread of COVID-19. Before we get started, I want to let you know that you can ask questions using the Q&A feature at the bottom of your screen. The outstanding panel I've assembled today will help us understand vaccines from several different perspectives. So today I'm joined by Dr. Paul Denton, Assistant Professor of Biology who specializes in immunobiology, who before coming to UNO participated in the conduct of fast-paced clinical trials focused on understanding immunotherapies on immunity, as well as disease cell persistence in HIV-positive individuals. Dr. Marcia Adler, School of Health and Kinesiology, an affiliate faculty member in UNO's Medical Humanities program, has teaching interests that include healthcare delivery with a goal to reduce health disparities and healthy aspects of aging. Dr. Robert Steele, Assistant Professor of Philosophy, who teaches ethics and does research in bioethics. He's particularly interested in the ethical regulation in biomedical research and the question of what, if anything, justifies imposing upper limits on the level of risk that subjects may be legally and ethically permitted to assume in the course of research participation. Dr. Kelly MacArthur, an associate professor in the Department of Sociology and Anthropology, is a medical sociologist and has written about the role of trust in the HPV decision-making process among college students. And Dr. Pedro Cantisano, assistant professor of history, who in December of last year published an essay called Brazil's President Rejects COVID-19 Vaccine, Undermining a Century of Progress Toward Universal Inoculation. The article was published in online The Conversation, US News and World Report, the Houston Chronicle, Yahoo News, and the San Antonio Express News. So let me begin. Since the late 1700s, when Edward Jenner developed a vaccine for smallpox, vaccination has been the centerpiece of the public health approach to infectious disease. Even before COVID, some have questioned the wisdom and safety of vaccinations as a standard preventative measure. So can you provide a general description of how vaccination works and evidence that vaccination is safe and effective as a public health policy? Dr. Denton, I think I'll start with you.
Sure, thank you. Vaccines, as we generally think of them, train the body's immune system to recognize a disease-causing agent, such as a pathogenic microorganism that can include viruses and bacteria. So vaccines are taken up by the body and processed in a way that allows the immune system to build what is called acquired immunity. So acquired immunity should not be confused with shorter-term passive immunity from something like an antibody transfer. And in that case, you can think like the convalescent plasma that's been discussed in recent news cycles. So acquired immunity is immunity that's built from scratch within the vaccinated individual. A very important aspect of acquired immunity is its durability. Acquired immunity has a memory component whereby immune cells that are specific for the pathogen are maintained in the body for an extremely long time. They're there in waiting. In the event that you're exposed to a pathogen itself at a later time, your memory immune cells become activated and they can respond quickly. We should note that acquired immunity and the development of immunological memory is a time-dependent process. So developing acquired immunity can take several weeks. By allowing the body to build acquired immunity in the absence of an infection, a vaccine will cause the immune system to be primed and ready to target and destroy the actual pathogen soon after it enters the body. That prevents the pathogen from establishing infection and maintains the health of the vaccinated person.
Okay, so that's a beautiful scientific explanation. Dr. Adler, from the public health perspective, is vaccination safe and effective? Would you say that vaccines have changed human health?
So I would absolutely say that vaccinations are one of the foundational elements that have allowed life trajectory to be expanded over time. Being able to vaccinate children against communicable diseases has saved thousands of lives. That's what's allowed our lifespan the trajectory of our lifespan to grow in the United States, is the availability of vaccines. So when we get to this kind of unknown organism, the question becomes back to the beginning of how safe are vaccines. And so from my public health perspective, and what Dave didn't mention in the early intro, is that I spent 40 years as a nurse before I jumped over to public health as a faculty person. So my whole career has been based on the value of vaccinating people, whether it's HPV, which is where I got acquainted with Kelly, whether it's childhood vaccinations so that we can enter school safely, all of those things. So in the United States, we have the benefit of a very safe mechanism. Everything goes through lots of clinical trials to ensure that what we as health clinicians administer to patients are safe. So vaccinations in the United States are very safe. One of the things about the vaccine that we're talking about now, with the 2 vaccines that are available in the US and the Johnson & Johnson that'll be available shortly, is none of those vaccines contain live virus. So feeding back to what Paul was talking about, you cannot get COVID from having a COVID vaccination. You cannot get flu from having a flu shot. One of the places that people get a little mixed up on is, if I got my COVID shot today and tomorrow I suddenly had symptoms and tested positive for COVID, what that would tell us physiologically is that I already had the RNA fragments from the virus starting to multiply in my body. The vaccine did not cause it. My body was already exposed to it prior to my vaccination.
Thank you. So the vaccines currently approved are using a formulation that is based on very recent knowledge and research. The speed with which they were created is truly unprecedented. They represent a revolutionary approach for vaccination that was made possible by many years of immunology research and development. So, Paul, or anyone, how does this new approach to vaccine development for COVID-19 change the way vaccines are developed in the coming years?
Yeah, it's truly fascinating, and I want to emphasize the point you made. The reason this is fast is because of all the decades of research that has preceded this moment and what we've known, and to be able to come in with what is essentially a plug and play approach to vaccines is a remarkable achievement in the vaccine development field. So the ability to deliver messenger RNA, mRNA, that just brings a tiny fragment of the virus into your body so that your body can recognize that little piece of the virus, so that when a whole virus comes in, it's primed and ready to go. It's just remarkable. And the plug and play aspect of it, that little piece of mRNA can be changed to recognize another part of that virus, or maybe a different virus or a variant of the virus. So it's something that the delivery, it's not that new. The speed of this is because of all the discoveries that preceded. In particular, if you think about the mRNA vaccines that we have right now, the 2, the Moderna and Pfizer, there was a paper in 2017 that actually showed, using the SARS-CoV-1 from the 2003 epidemic, they showed a specific change that you could make so that that spike protein could be made and put into cells effectively. So it was a 2017 discovery that allowed the plug and play in 2019 to have the vaccine that we have today.
Thank you. So, trust. I was watching the press conference by the press secretary of the new administration. She called it vaccine hesitancy. is clearly a major issue in the successful distribution of vaccines. I read in the New York Times yesterday or the other day that one of the challenges we have in the public discourse is that, COVID vaccine discussions focus too much on warnings and limitations. They're not 100% effective. Vaccinated people may be able to spread the virus. People shouldn't change their behavior once they get their shots. So how important is this messaging? And what should the messaging sound like so that we can focus on how the vaccine is going to save your life and that the vaccines are essentially 100% effective? Kelly, you want to start?
Yeah, well, I mean, vaccine hesitancy is not something new, and that's not an easy question to answer about how we can provide messaging that improves the trust of people, because whether or not people are willing to get any vaccine, including the COVID vaccine, is a reflection of how they feel and are integrated in society more broadly. And so there's trust in the actual vaccine, but what my own research and research for several decades now about vaccines has shown is that how integrated you are into society will determine in part how willing you are to get a vaccine. So in other words, the level of social cohesion. So what political scientists and sociologists tend to call social trust. So like, how much do you trust people in general? And so for mostly stemming out of Robert Putnam's work, who's wrote the infamous book, Bullying Alone. A new version just came out. He's a political scientist, but the social trust and trust in all of our institutions, including healthcare and pharmaceutical and people in general, has been eroding, and we have less of a sense of community. So to answer your question, if we want to increase the intent of people to get this vaccine or any vaccine, I would say that we need to encourage social cohesion and a sense of community more broadly, which then makes people more willing, especially if there are like biological or physical risks, they're more willing to do this as an act of altruism.
Anyone else? So just to follow up, Dr. MacArthur, I know you have studied the role of trust in vaccine decision-making process among college students. What did you learn from your study of American college students that might help build trust or in this process?
Yeah, so I have the same answer. So among younger people and people who are in college in particular, my research was on the HPV vaccine, right, which is an STI, and it brought up different issues about gender and sexuality and young adolescent sexuality. And so it was a whole different thing. But they too are very skeptical of the pharmaceutical industry and the healthcare system as a whole. People tend to trust their own doctor. You know, if you ask someone, do you trust your doctor, the doctor you go to? The answer is overwhelmingly yes. But if you ask people if they trust the healthcare system, then it's no. And so again, trust has been declining in our systems, and that is definitely hitting college students. And then in relation to, well, you know what, I am guessing you have a question about something else, so I'll stop there.
No, it's okay. Let me remind you of the audience that you can ask questions using the Q&A feature at the bottom of your screen. So we welcome questions. So this building trust, there are probably lots of questions that we might ask that could get at this. You know, I think, Dr. Adler, I think you answered this one already. Can getting the vaccine make me sick with COVID? I think you said no.
It absolutely cannot. And feeding off of what Dr. MacArthur was talking about with trust, I think one of the things we've seen in other arenas, including HPV, is when you have modeling to look at so that you know somebody that had a vaccine and it didn't cause ill health in any way, they're more likely to do it. And so when things like vaccinations are integrated into other health messages like exercise and getting enough sleep or whatever, when it becomes normalized and it's part of what everybody does, it becomes a little easier to fall in line with the recommendations. When it feels out there, like I'm the only person I know that got this vaccine, it feels a little scarier.
So another question, if I had COVID and recovered, do I need the vaccine?
So 100%, I don't know if that question's for me, but absolutely. Because, and Paul can jump in here too, when you have the disease, people's level of disease lives on a spectrum. And so the amount of antibodies that my body builds from my sickness might be a few antibodies, and my friend down the street that got it might have a lot of antibodies. And so for uniform herd immunity, we need everyone to be vaccinated. And with this particular disease, because it is so virulent and there are so many negative outcomes, we need a higher threshold of vaccination to build that herd immunity. If we have a little bit of illness and it's not as severe, herd immunity could be 50% of the population being vaccinated. This one, the statistics and data tell us that we need somewhere between 80 and 90% of people vaccinated. And the other thing we haven't mentioned, we're talking really about a US construct, but this is a global pandemic, and we live on a really small globe, quite honestly. And so this pandemic is not going to go away until all of us step up and do what we can to help it.
Yeah. And I would add to that, Marcia, because I think it's a great explanation, and bringing in the second or the previous question as well. You cannot get the infection from the vaccine. That's unequivocal. But it doesn't mean that you might not have an immune response that you perceive in your body when you get the vaccine. So you can still maybe have a little malaise or potentially a little more, but that's actually an indication that the vaccine is doing its job immunologically in your body when you have that response to a vaccine. So take that as a plus sign, not as a negative if that were to occur.
So I'm absolutely pleased when someone tells me they've got a vaccination and now their arm hurts a little bit, they slept a lot yesterday, whatever. I say, you know what, that tells me your body really needed that vaccine. That tells me how sick you could have been had you not gotten that vaccine. So back to Kelly's response, that puts the spin on it about the value of what you just did. We also know, and I've been working at the Med Center with their vaccine clinics, people oftentimes, they might have their response with their first vaccine, or they might have no response with their first vaccine, and then the response comes with the second one. So the arm gets sore, they get really tired or something. So there's not a good predictor of, oh, I'm not going to feel good after my first one, or I'm not, because it's different in each individual. And that also tells us that our body is not familiar with this disease process.
I wanted to clarify something about herd immunity and what it is, because somehow over the last few months in the media, the term has been co-opted to mean that we just let people get the disease. And that's what herd immunity is. And so if anyone has that idea that herd immunity means not giving people the vaccine, there are several different ways you can achieve herd immunity. And so it really is not directly connected to the vaccine or not. So herd immunity is where a certain percentage of the population is immune to the disease. And the easiest way to make people immune to the disease is the vaccine. So normally that number is around 80% of the population, but it varies for each individual vaccine separately. And so then when about 80% of the population is immune, again, typically from the vaccine, not from letting people naturally get the disease, then people who can't get vaccinated because their immune systems are compromised, or because they're infants and too young, or whatever it is, are protected by the herd. And so that's the origin of the term, that the herd being immune. So again, I just want to clarify that herd immunity does not mean letting people get the disease naturally. That's only one way to make a population immune, and certainly not the most efficient or foolproof way.
And the herd immunity concept circles back to what Marcia said earlier about altruism. You
Yeah.
can take the vaccine to protect that immunocompromised person who can't be vaccinated themselves. So it's looking outside of your own self to the greater good.
I believe, if I'm not mistaken, Sweden tried
Yeah.
a herd immunity process that did not involve, that basically just like opened it up. I don't think it turned out very well, did it?
They actually retracted that after a while. It became so awful to handle.
Well, and as far as altruism, the United States is a relatively unique case because of our culture and our very neoliberal individualistic ideals. Because other countries, especially other vaccines, they are better able to easily implement mandates. Where here in the United States, being so individualistic, and because of our culture, we're generally resistant to our government telling us what to do in the form of a mandate. And so then it relies on each individual, and that's why trust becomes so important, because then it's up to each individual to make this decision, when other countries are more successful in just saying, you have to do this for the greater good, and taking the decision making out of it.
I think that last point is one that always, it resonates with me, Kelly, because the tension between the public good and personal rights seems to be one of the things that, and probably get into ethics here, but that's one of the things that I struggle with sometimes myself, when it seems pretty obvious to me there are times when the public good should be like pretty clear on some issues, but individual rights get in there. So there's a question from the audience here that is related to this discussion. It may have been answered already, but I want to make sure that the question gets asked, because this is a question that clearly is getting to the issue of trust at some level. So is research continuing in regards to the negative consequences from getting vaccinated years down the road? Is the vaccine 100% safe from serious side effects and long-term dangers? Or do we know?
So do you want me to start with that? I can tell you that the clinical trials are, my husband and I are participating in a Pfizer trial. We were vaccinated in September. When we signed up in September, we knew that our trial was going to go for sure for 2 years. So even though we were vaccinated, we check in every single week for 2 years at least. And if you become ill, you go back to the site and they check you. So there is long-term, probably there will be long-term follow-up even beyond the 2 years. Do we know that the vaccines are safe? To the best science knowledge that we have right now, and from all the tracking that we've done, absolutely. The United States is pretty risk adverse. And so we're pretty cautious before we put the good housekeeping seal of approval on something. Does that mean somebody might not have an adverse reaction? We know early on that certain populations had some, and typically there are people that have reacted to other vaccines in the past. One of the questions along these lines is about vaccinating pregnant women, because in the clinical trial business, it's really hard to justify doing something that could potentially harm an unborn baby. With the vaccine that we're dealing with now, with the Pfizer and Moderna, the American Academy of Gynecology and Obstetrics really wants women that are pregnant or planning to become pregnant to be vaccinated, because pregnant women are disproportionately the ones that get very sick when they do get COVID. And if you've ever had the unfortunate experience to see a pregnant woman face down on a ventilator, that outcomes for those infants become very dire for the mom and the infant. And so the cost benefit, again, this is our ethics. There's a decision that has to be made to do the best we can to save that infant and save that mom, or let them perish from a disease that we know is vaccine preventable. So there's that tug of war internally about making that decision. But the infectious disease science and the Academy of Obstetrics, they're really strong on vaccinating pregnant women.
So you had mentioned in part of your answer, you mentioned, compromised immune systems. Is how safe is the vaccine to those who have compromised immune systems?
So
I would just speak to that. These vaccines, the mRNA vaccines that we have, the Moderna and the Pfizer, they literally are delivering a piece of RNA into your body. And our bodies, our cells are already full of these same types of RNAs. It's just a different sequence of the nucleotides in that RNA that's there. So it would generate a different protein, but there's nothing in it. It in principle is one of the safest vaccine platforms in existence at the moment because it's so simple in its design, but there's nothing in it that could harm an immunocompromised person, but an immunocompromised person may not have a response to it that would be protective. And I think that's the distinction in what was being said regarding immunocompromised.
Okay. So there's a question here from the audience that going back to the question of herd immunity. What happens if Nebraska reaches 80 to 90% goal, but other states do not? Same on global scale, so the US reaches the goal, but the other nations do not.
we don't have it.
What's that? What?
I said, then we don't have it. The herd is the world. The herd is not Omaha, Nebraska, or the herd is not Nebraska. We could fill up the Husker Stadium, but if somebody that isn't part of that, we could have a catastrophe.
Yeah. So do vaccinated people still have to change their behavior? They have to wear masks and they have to do social distancing and all the things that we are currently doing that some people don't like to do?
Absolutely. Yep.
As the rollout of vaccines begins, there are obviously many questions being raised about rollout, including the big question of how different groups of Americans are being prioritized. So I want to get to the question of ethics. Dr. Steele, can you tell us what ethics means in this context? Is it as simple as doing the most good while doing the least harm?
So that's an excellent question. I think, like many ethicists, that ethics is everywhere. And so there are all sorts of different things we can ask ethical questions about, from what the public health officials are doing at the very top to how many times you're going to the grocery store and whether there's an alternate way you could be doing that. It's all up in the air for assessment, but there are some big questions that have attracted a lot more attention recently, and rightly so. And one of them is the one you emphasize with vaccine rollouts and trying to determine, who gets what spot in line. We all need to get vaccinated by the end. That's the goal, is really everyone who can and who can have a productive immune response. However, we don't have all those vaccines right now. So we got to start with some people and work out to others. And this is really just an instance of having a very valuable resource, but not enough. And we see that's an ethical problem that comes up in all sorts of situations, even just earlier in the pandemic when we were talking about limited numbers of hospital beds or ventilators in overrun systems. You just don't have enough for everyone. So how do you decide who gets it? In this kind of situation where you have like a limited resource, there are two main ethical values that bioethicists tend to put at the forefront. The first is the one that you just mentioned, try and create the biggest benefit, try and prevent the most harm, get the most value out of what you have. So give out your vaccines in the order where you expect that doing that, you're going to end up saving the most lives or the most healthy life years or whatever. That obviously matters, but I would say it's not all that matters in answer to your other question, or at least most think that it's not all that matters. Because also there's a second value in fairness. And that means a lot of different things to different people, but bioethicists often think about fairness as a matter of paying special attention to the people who are doing less well off. So for one example of how these values could come apart, maybe in this context, maybe we could save more lives if we started by just vaccinating urban populations and only moved on to rural populations later. Doing the cities can be logistically easier and faster, and anything that makes it faster makes it save more lives. But that would leave rural people entirely out in the cold, and rural people are also often already disadvantaged in other ways, making less money on average, dying earlier more often, and having worse access to health overall. So if we did that policy, then it would seem like we were exacerbating existing inequalities, and most bioethicists are not going to recommend that kind of approach. So instead, you have to come up with some kind of satisfying balance. You want to save more lives. You also want to do so in a way that's fair and justifiable to everyone. And that's sort of trying to balance those values is something that you see repeat over and over in these ethical questions in the pandemic. I mean, there's much more. I could keep going, but I think at least there's your little.
Keep going. You can. So you've mentioned a couple other ethics values that we should bear in mind. You've mentioned a couple. Are there others that we should be?
So, saving lives, healthy life years, also prioritizing the worst off. Transparency, that's another one that people think is ethically important, and it relates to social trust. Fairness in subject selection for the trials. There's if it's just list all the ethical values that are relevant to the pandemic, I'm going to get confused, and there are too many to list in a sensible order. But
yeah, that's fair enough. So
yeah.
I'm looking at this question because you were kind of getting at there. So thinking of this question from the perspective of ethics, so what would you tell our questioner who says, how do we build trust within our communities so that there is a less vaccine hesitancy? We've heard it from one perspective. So what would you say it from your perspective?
So from my perspective, in the bioethics world, like robust independent ethical review is something which, at least we hope, helps promote social trust, and which exists for the trials, which Marcia was talking about earlier, being in them. All of those trials testing these products, they have to go through all of these hoops. We have a robust system of pre-approval before it even gets into a person, where we're trying to make sure that this isn't something that's gonna harm or poison people, and we scale up gradually, and there's a whole industry dedicated to getting to something that we're confident in putting the arm in the person on the street. So that whole apparatus is trying to help with social trust. But there are also questions beyond that, which, I mean, I'd be interested to hear people who have looked at public trust more directly and empirically, what they think about in terms of managing vaccine hesitancy, something that bioethicists are quite concerned about, particularly given their concern with not exacerbating existing inequalities, is higher levels of vaccine hesitancy and lower levels of trust in the medical system in historically marginalized populations, particularly racial minorities, in some cases whose lack of trust in the medical system may be based in real tangible experience of being disrespected, mistreated to, and not listened to by health professionals, both of many people in their communities or even them themselves. And so how to respectfully and transparently try and bring people back into the process and realize the very important benefits that they'd be missing out on with their hesitancy. I don't have an answer to how to do that. I would be interested to hear what others think.
I would definitely like to echo what you just said about inequality, which I think is at the root, especially now, but always has been. And I don't think you can separate vaccine hesitancy and trust from the racial tension. That's really even gets at the gravity of what we're going through right now as a culture. But I think that's at the very root of how we can improve trust. And what the problem is, and because we've never been so divided in so many ways. And empirical research absolutely shows that disadvantaged groups have less trust. And like you said, especially among Blacks in the US, for very good reason regarding healthcare, but also income inequality, and in some cases, gender inequality, and all other types of inequality also breeds mistrust or distrust as well.
Yes, thank you. You've both of you have kind of anticipated the question that I've had. I'll go ahead and kind of put it out there because just in case there's anybody who wants to add, so as you said, these inequalities, Black, Hispanic, Native Americans are dying from COVID at nearly 3 times the rate of white Americans. according to the Center for Disease Control and Prevention Analysis. And obviously there's, as you said, there's a level of mistrust among Black Americans that's rooted in, as you said, there's reasons for it. It's rooted in generations of mistreatment. You know, such as the infamous Tuskegee syphilis study and Henrietta Lacks experience. Do you have any more thoughts as to how we can address these disparities?
Well, I'd like to say, so in the past 60 years, the most robust finding in medical sociology, in stemming out of what is called fundamental cause theory, is that socioeconomic status and other types of social conditions like race affect health. So no matter how you measure health, you know, whether it's life expectancy or on the individual level, like asking people rate your health, and no matter, you know, how you measure socioeconomic status by income, education, no matter what it is, we're always left with this inverse relationship with, as, you know, SES goes up, or actually it's not inverse, then, you know, health gets better. And so 10 years ago, when I got interested in vaccines, I thought it was really interesting how it seems to be like this one exception where anytime a new resource comes out that can be used to improve health, those who are more advantaged are more likely to use it and benefit more greatly from it. So, you know, public health raises health like this, but health disparities, we want to, you know, kind of go like this. And so when vaccines come out, those who are already in more privileged, you know, places are more likely to get the vaccine and to benefit from it. But with vaccine hesitancy, or, you know, what we a few years ago and still now call the anti-vaxxers, they're more likely to be, you know, in these super wealthy places in California and Washington and Oregon, and that they're well educated. And so these are not disadvantaged groups. So with COVID and every other vaccine, we're going to see two simultaneously opposing processes of those who are the most negatively affected by COVID, including Blacks, Hispanics, and other disadvantaged and by income groups, are going to have less access to the vaccine for a variety of reasons. And then those who are on the other side of the socioeconomic status are going to be the ones who are vaccine hesitant because they're in a privileged place where they can do that. So at both ends of the socioeconomic spectrum, we're going to see, you know, these two opposing problems as far as distributing the vaccine equally and getting to that 80%.
Very interesting. Thank you. Anyone else? So, as is true with any subject, we can learn a great deal from history. Dr. Cantisano, what lessons can we learn from history here, and what what is it that, you know, Brazil's President Bolsonaro is doing to undermine a century of progress toward universal inoculation in Brazil?
Well, I'll start with the last question. The Brazilian president has explicitly said that he will not get the vaccine, as opposed to many other presidents around the world across the political spectrum. Now he's kind of, you know, changing his mind a little bit, that others have sort of gone towards the sort of to favor vaccinations. But I think what he's really doing is mobilizing his political basis. And I think that it doesn't matter what it is, in this form of populism that we see in the world today, makes opposition to vaccinations very easily manipulated in order to continuously mobilizing a political basis that he acquired, about 30% of a political basis that he acquired in the elections, right? And this is something that we see in the history of opposition to vaccinations. In Brazil, there was, for example, a huge anti-vaccination revolt in Rio de Janeiro, Brazil in 1904. And there we saw some radical oppositionists to the government manipulating information and manipulating people into revoting in order to destabilize the capital and in order to overthrow the government that was implementing smallpox vaccinations, right? Other things that we've learned from this revolt and that Brazil has changed in terms of public health are the fact that public health was, during the late 19th and early 20th century, violent. And that also speaks to what others have said here, the hesitancy of particular minorities communities, Black communities, both in Brazil and the United States. It is part of a history that informs us that the methods chosen by vaccinators were many times perceived as violent and indeed violent. So very different from the kind of educational support that we have today, very different from the kind of voluntary vaccination sort of options that we have today. So this is something to distinguish also history from what is currently occurring. And it's part of the learning process among people in public health specialty, right? Another thing that didn't come up yet in our conversation is the fact that religion played a big role in anti-vaccination movements, and the fact that religion is a big part of how people think about death, how people think about sickness. And I think that one thing that we might learn from this is that religious leaders might play a big role in convincing people to get vaccinated, in bringing people to the side of vaccinations, to the side of science, and to the preservation of life in scientific terms. And finally, something that also came up and is historically true for Brazil, the US, Europe, many places, is this language of individual rights and individualism. It came up as an opposition between individualism and altruism. But I think that we might try to reconfigure this language of rights, which now is used as I have the right not to get vaccinated. We might try to reconfigure it as in terms of a collective right, right? We have a collective right as society to live in a healthy environment, and vaccinations are the path for that. So this is something that we've learned with history, we've learned with vaccine revolts, with resistance in Brazil and the US, and I think that, I would ask what other things about this.
Thank you. That was interesting. At the beginning of your response about President Bolsonaro, and then at the end, you raised the specter of the politics of this. So how is it that something like this gets politicized? And maybe I need a political scientist here to answer this question, but why is it politicized? Because this doesn't seem to be something that should be necessarily politicized. It almost turns in like political parties take a stand on one side or another on this. And I'm trying to think, what's political about this? Is there anything political about this?
Well, I'm curious about what others think. What I think is that there is a hesitancy anyway among people, and this hesitance, and there is enough. It is possible to raise enough questions about vaccinations in order to make it a politically divisive issue. But also there has been a load of misinformation, and that's historically true for vaccinations, where fake news were already a thing in the early 20th century, and people published those fake news. For example, in Brazil, it was exactly what Marcia was talking about earlier, and in the United States too, that people believed they would get the disease if they got vaccinated, right? So that's something that has carried a weight, and that groups, anti-vax groups, privileged ones like the ones that Callie mentioned, have invested in this kind of misinformation and alternative studies, right, that don't really carry scientific relevance. And all of this created hesitancy, in addition, of course, of the history of violence in public health in Black and Hispanic communities. All of this create enough doubt that it's easily manipulatable, right? If that's a word. It's easy to manipulate it for political reasons. That's what I think.
Well,
I think it's been very deliberate too.
Yeah, go ahead. Both of you.
Go, Kelly.
I think it's been very deliberately made political, and not just with COVID. This was going back years ago, and again, I think it's propaganda that plays on our cultural values. If you call something socialist in this country, it's sure to just immediately ignite people against it. And so when you say that, getting the vaccine is the government telling you what to do, and certainly a mandate is, absolutely telling you what to do. If you can convince people that this is, in treading on their rights, then you can easily create opposition to it. And so I think it's just another political ploy.
Well, the other thing we haven't mentioned is when we think about health disparities and access to healthcare, it's very political. Who gets healthcare? Who has access? Who can afford it? So, in our world, is healthcare a right or a privilege? The way we operate, it's a privilege. You have to have a job good enough to provide you healthcare.
I would love to hear what Dr. Steele has to say about last week. I saw that several states, or at least my home state of New Jersey for sure, had bumped cigarette smokers up on the priority list for getting the vaccine. And I know how I personally feel about that. I think it's great because, Marcia, it goes to this idea that, it just supports the philosophy that no matter how we got there, that it's, healthcare is a right. But I definitely am sure that there's some opposition. So, Robert, what do you think as an ethicist?
So this is, I imagine that the concern with bumping cigarette smokers up, so I mean, the obvious rationale for doing it is that they're at higher risk. And so again, you're getting more value out of your vaccine by giving it to them first, because it's more likely to prevent what the alternative would have been that they died because they have this. So that's the obvious rationale for doing it, is you're producing more benefit from the limited supplies you have. I imagine the concern, which is a common concern, is that smokers are in some way responsible for their health. So it's like, it's kind of their fault that they're smokers. And so then letting them cut to the front of the line feels gross because we shouldn't reward bad behavior or whatever. That response is fairly dubious in a number of ways. So people point out, so Kelly, you were talking earlier about how lower SES is like a very strong predictor and arguably cause of poor health outcomes. Also cause of smoking. Smoking correlates very strongly with membership in various lower status and excluded classes, which then makes the responsibility attribution at least somewhat more dubious. Like, oh, I get to feel so good about not being a smoker. Well, like, spoiler alert, 1% of people with PhDs are. So like, is it really this great accomplishment that I had that I didn't turn out to be a smoker? Maybe not. It gets dicier. There are conditions, or there are sort of analogous situations where it seems like maybe we, at least for some reasons, should hold people a little more responsible. So this comes up in the context of like the alcoholic who's on their third liver and continues to not change their behavior. How many livers are you going to give them? I think those judgments are best rationalized, even there, not on the basis of responsibility, but instead just on the basis that, well, if this person's on their third liver and that lasted for 2 years, how long do we think the fourth one is going to last? So it has to do with incentive and behavior effects. I mean, I don't think anyone's going to start smoking to try and get vaccinated earlier. So I don't think that those are like super relevant here. So I'm also pretty on board with smoker prioritization. That's a little overview of some of the issues that are involved.
I would like to just go back to the politicization of science. And data is not political. The numbers are not political. It's the messaging around it that becomes political. And personally, as a practicing researcher, it just kind of breaks my heart to see the numbers go in that direction when they are apolitical by themselves. But the idea of the misinformation, it takes like 10 minutes to come up with a really good lie that you can spread. And it might take years to design well-controlled experiments to refute that lie. And in that period of time between the two, then the lie just gets bigger and bigger and bigger, and it's hard to control. So it's really a major challenge, and I don't know that I know the answer.
No, that's terrific. I'm glad you brought that up. That's terrific. That's a really good point. So there were a few questions, and I'll get to those other questions in the box. So is there any reason to believe the current vaccines will be effective against the variants, or are they tweaking the variants to respond to the are they tweaking the vaccines to respond to the new variants?
Moderna published, I saw this morning, that they are actually working towards a potential booster vaccine that will change that plug and play component just subtly so that it will cover the variants. So that is actually active research. As I would say, it's in a proactive stage because we don't know that the current vaccine is not efficacious against the variants, but to be certain, they are working in that direction.
Right. This question, if Dr. Fauci probably doesn't know, but do you have thoughts as to how long is this going to be? Is this vaccine going to be an annual vaccine like a flu shot, or do we know yet?
We don't know yet.
That's still unknown, yeah.
So this is a different kind of question. How do you handle or approach members of the community who gaslight your work in science healthcare? Any thoughts on that?
Ones we can say
How do you
here.
engage? How do you bring people into a conversation about these issues that may not be so interested in a conversation?
I'm just myself. If it comes up in conversation, I say what I do, what I think, and it doesn't change me at all.
Yeah, I say bring them on. I'm happy to have the conversation. Because oftentimes they're really operating from a different perspective. Sometimes it's an emotional perspective. Sometimes it's there's a lot of miscues when people don't understand. And I don't know why in school people thought science, I do know, but people thought science was hard. It's kind of like math. We know a lot of kids don't persist in school because they don't want to do that one math class. Well, science is a little like that. So now when we make a decision based on science, something they didn't understand, it's like we're speaking a language they don't get. So sometimes when we meet people where they're at, even the most belligerent, resistant people, you can get them on your team when they get there, when you find that common ground.
But I think how people feel about vaccines and their personal willingness to get it has way more to do with social and cultural things than it does. I don't think it necessarily reflects a misunderstanding of the science, or like some sort of risk assessment that is strictly based on biology and physiology. It's more cultural, and how does this, risk is about your cultural values. And so that's why it's difficult to have these conversations when that's what they're based on.
And in public health, sometimes we use a term called a cultural surrogate. And so we send someone that matches the culture to help field those questions. So you don't send an old white woman in to figure this out. I find someone that looks like them to be able to be the messenger.
Yeah, I mean, I was mostly referring to American culture as being so individualistic.
Yeah, but I think there's miscues even in Omaha, like in our refugee population, because there's a lot of things that aren't quite understood and everything doesn't make sense. And they're not trying to be anti-vaxxers. They just don't have the full complement of knowledge to make that decision. And they mistrust for a reason. They can get taken advantage of easily.
But like the mothers in Orange County, California, they're not misinformed. They're not uneducated. They're just have really neoliberal views and are just trying to do the best for their child. And it just turns out to be a really individualistic view. But,
those people can purchase their way out of trouble. If one of them gets sick, they can afford the ventilator. They can navigate their way to the healthcare system.
Yeah.
That's kind of that elitism you were talking about.
So let me, I'll ask one more question, because I think it's probably the question that everybody wants to know the answer that I'm sure all of you have the answer to. Is it possible to project future normalcy? Is it
I think
possible,
chances
and
are-
of course, this is from Connie O'Brien, who wants to bring her kids back for Anchor Stars, right? So is it
Yeah.
possible to know when it will be safe to invite children back to campus?
Didn't Chancellor Gold just promise us that everything's going to be normal by fall? So that's what I'm putting my money on.
Okay. Well, Dr. Steele, I know you have organized a series of discussions related to this topic. I believe the first one's tomorrow. You want to briefly discuss your series?
Yeah, so thank you for the chance to do that. And also thank you again, everyone else. It's with pleasure that I can introduce a new lecture series here at UNO. This spring, the philosophy department, in coordination with the medical humanities major and the Ted Kuser Health Humanities Center, is going to be launching our Ethics of Medicine speaker series. And every last Thursday of the month, aka starting tomorrow at 7 p.m. Central, yours truly will be moderating an hour-long Zoom event featuring a scholar in medical ethics applying their cutting-edge research to pressing contemporary social problems. And the first talk, again, tomorrow evening, will be on the ethics of enrolling minors into COVID-19 vaccine trials. We are very excited and honored that Dr. David Wendler will be presenting to us. He is the head of the section on human research ethics in the bioethics department of the US National Institutes of Health. Widely published in extremely prestigious venues and a leading figure, his work has helped shape the federal regulations on research ethics, and so it's a real treat to have him out. And I hope some of you might consider joining us. The chat is disabled, so I can't share the link that way. Is there a way that I can share the link with the audience for the?
We're about out of time, so I think for more information, they can just contact you or they can contact me. I have the information too, so they can contact me. So I want to thank all of you for joining me. This has been a terrific conversation, very valuable, very informative. I'm sure everyone's enjoying it. Thank you to our audience for joining us today. This has been recorded, and so it will be available on the Arts and Sciences website within the next day or so. So that you can tell all your friends who weren't here today to watch it, because it's very informative. So our next seminar will be held at noon on Wednesday, February 24th, and will focus on the brain. For more information about programs in the College of Arts and Sciences, please visit our website. So thank you all, and thank you all for joining us today.